Good afternoon, everyone, and welcome to this week's Independent Sage briefing. My name is Goody Singh, and I'm going to be your chair today. The pandemic has had a significant impact on all our lives, but has specifically been a burden weighing on children and their education. A recent report from the Department of Education points out how, despite schools opening up, rates of school absences have been very high, with absentee rates now twice as high as pre-pandemic levels. With this in mind, there is no doubt that more needs to be done to make schools safe. And this involves restricting the spread of COVID as much as possible, keeping children and staff healthy, and ensuring smooth school attendance. This is going to be the subject of our discussion today, COVID safety in schools. And to discuss this topic, we have three guests with us today. Kim Sunley, who is the National Health and Safety Officer of Unison, Michelle Wong, an architectural designer involved in Clean Air Classroom campaign on Twitter, and Dr. Mary Bousted, who is the Joint General Secretary of the National Education Union. But before we go on to the main session, I would like to invite Dr. Kit Yates to share with us the latest COVID numbers. Over to you, Kit.
Great, thanks, Goody, thanks for that. Hopefully you can all see the slides and that they're now full screen. So I've got about 10 minutes, so I'm going to go through things fairly quickly this week. The good news is that it is a good news week in many senses. So prevalence is coming down across all home nations, according to the ONS infection survey. Hospitalizations are also decreasing, relieving some of the pressure that's been building up, but obviously not all of it. Deaths are also starting to fall. Prevalence of long COVID has come down a little bit. But as we're going to hear in today's session, the impact on schools has not gone away, although, of course, we're in the school holidays at the moment. So this is what I'm going to talk about: prevalence, hospitalizations, deaths, long COVID, and then I'll do a little bit on schools data to set up the session. So firstly, prevalence. Oh, okay. I haven't got my prevalence slides. Oh, yeah, here they are. Sorry, put them in the wrong place. Okay, so Northern Ireland has still the highest prevalence, but the trend seems to be a little bit uncertain there. All the other home nations have started to come down now, and you can see this in this plot here more clearly. You can see red, green, and blue have all come down quite steeply in the last couple of weeks, whereas Northern Ireland the trend is slightly less clear. But we need to remember that ONS is also lagged by a couple of weeks, maybe up to a couple of weeks, 10 days perhaps. So actually these trends of descending prevalence of COVID has probably been happening for a little bit longer than shown on this chart. Again, looking at the breakdown in different English regions, orange is the latest week and grey are previous weeks. You can see that we've seen good falls across most regions, slightly smaller in the southeast and southwest, but they saw bigger falls previously. Similarly, across all age groups, we're seeing big falls in prevalence, particularly in young adults, young working age adults, slightly less so in older people, but still decent sized falls, which is good because these are the people we're most worried about having the adverse impacts of COVID. So moving on to hospitalizations now, you can see that hospital admissions are coming down. They peaked around the same sort of level that we saw in the previous two waves, a bit under 2,000 admissions per day. It's now coming down, and the last 2 days of data showed admissions below 1,000 a day, although the 7-day average is still just above that. Just zooming in on these waves, you can see this latest wave was a little bit lower, which is obviously is good, but of course we would like to make it much lower and, if possible, avert future waves and do everything we can to keep the reproduction number below 1. The other good news is that mechanical ventilation beds have also started to decrease. The number of people on mechanical ventilation started to decrease. Again, it rose to similar sorts of levels to the levels we saw in the previous wave, not quite as high, and now is coming down. So these are all good indicators. Looking at deaths, so this is deaths within 28 days of a positive test. You can see we didn't rise as high as we had done in the previous two waves. And actually, these figures are probably overestimates of the number of people dying because of COVID. This is deaths within 28 days of a positive test, which previously has actually been a really good indicator, but now is not so good. So really, we need the ONS data, which is deaths from death certificates, which is now also just about starting to show a decline, although it's worth bearing in mind that this most recent data is slightly incomplete. And so these figures will rise slightly, but it looks like we're coming down. So the deaths within 28 days of a COVID test figure is useful for the trend, but not for the absolute numbers, whereas this data is more useful for the true numbers numbers of people dying from COVID. We didn't quite reach 100 deaths a day, but we got close to that figure, unfortunately. But it's good to see that we didn't reach as high levels as we had done in previous waves, and that the deaths are now coming down on the back of this wave. And again, looking at deaths in care homes is another sort of indicator of this. You can see that we've just started to see decreases in that metric as well. So it's good that these things are coming down, although of course it's worth remembering that they did get to high levels, and actually certainly when it comes to talking about prevalence, if you were concerned about the prevalence level on the way up, then you should be equally concerned about that prevalence level on the way down. Looking at long COVID, we've seen slight decreases again in the number of people reporting suffering from long COVID, down from a peak of about 2 million a couple of months ago, down to about 180,000, 1,800,000 now. It's possible that we'll see this increase again on the back of the wave that we've just had. This data won't account for that latest wave. Looking at the impact that long COVID is having on people's lives, 21% of those reporting long COVID say it impacts their everyday activities a lot, 51% say a little or some, and only 28% saying not at all. So this is a huge problem, impacting 1,800,000 people, almost 2 million people, a lot of them having their lives impacted significantly. Again, you can see that the trends in these figures had been rising, but have now fallen slightly. This was up, the number of people who were impacted a lot was up at 400,000. That's come down to about 370,000 now, but still huge numbers of people impacted by long COVID. And you can see the trends in how long people have been impacted. And again, this figure, the people have been impacted for more than 2 years on the right-hand side here was up at 400,000. It's come down slightly, but still huge numbers of people suffering long COVID for an extremely long period of time. So I'll finish by talking briefly about some data that we have on schools and the impact of COVID on schools. So firstly, I'll continue with talking about long COVID in school pupils. So you can see here the data is broken down by green is years 12 and 13 pupils, orange is secondary school pupils, so 7 to 11, and blue is primary school pupils. So you can see proportions of children, around 8-9% of children suffering symptoms for longer than 12 weeks, similar sorts of numbers having their daily lives affected by ongoing symptoms, and slightly smaller numbers fulfilling both of those criteria for long COVID. You can see actually interestingly that it's highest in the oldest pupils, the proportion, although of course these students are only 2 school years, so they account for fewer overall numbers, but you can see the proportion is higher the older the students get. If we break these down and put in the absolute numbers, it's the number of students who are fulfilling all the criteria for long COVID is around 235,000, which is a large number of pupils who are having their lives impacted still by long COVID. In terms of ventilation data, back in summer last year, Gavin Williamson promised that he would deliver 300,000 carbon dioxide monitors to schools by October. That didn't happen, but eventually those monitors were delivered before the end of the autumn term, so that schools were at least able to monitor carbon dioxide levels in their classrooms, which is, we think, a sort of proxy for how good the ventilation is in the room. Of the classrooms or the schools that were reporting their CO2 levels back to the government, 12% of those classrooms had a reading over 1,500 parts per million, which was the government's threshold of when you needed to improve ventilation, although I'll say in a second that it's not a universally agreed upon threshold, certainly. 9% of those classrooms were, three-quarters of those classrooms, 9% of classrooms overall, were able to remedy that high level by opening windows and doors, improving ventilation, but 3% weren't, so that's about 9,000 classrooms. The government then undertook to deliver HEPA filters to some classrooms. They delivered about 8,000 in total, so not enough to meet the needs of those 9,000 classrooms. And I guess the thing that I'll mention now is that 1,500 parts per million threshold that they used is typically the very upper threshold that anyone ever suggests is indicative of poor ventilation. Actually, what would be more interesting to see is which classes are reporting at least 800 parts per million, because that also, according to this co-schools diagram, has the potential for stuffy and stale air, and more quite importantly for all classrooms, lethargy in learners. So, you know, improved learning as well as improved health could come out of better ventilating places. So this 1,500 parts per million figure is not hugely satisfying. We'd like to see data about this, but unfortunately the government data don't report that. The last thing I wanted to suggest about schools is on school absences. So again, this data is not disaggregated by COVID. That they stopped doing that. I guess because you know, so what it means now is that we can't actually distinguish what proportion of the absences are for COVID reasons and what proportion aren't, unfortunately. But you can see in the last week of school, in primary schools, 16% of pupils were absent, and in secondary schools that was 25%, and that had been rising throughout the school term as COVID had been rising. But again, we can't attribute causality to this because we don't know why the reasons for these absences. These are figures from a report from the Sutton Trust suggesting how much absence year 13 pupils, so pupils doing their last year of A-levels, had over the last year. So 16% had no absence, but actually 21%, so 1 in 5 year 13 pupils were absent for more than 4 weeks, almost a month of school they missed out of the 9 months of school that are available, excluding holidays. So this is a significant number of pupils. Again, 13% missing between 3 and 4 weeks, so large levels of absence. I guess the question you could ask is, are these very different to pre-pandemic levels? And the answer, as Goody suggested in her introduction, is yes. If you look across years 7 to 11, the orange bars are pre-pandemic absences, so 2018-19 and 2021-2022 are in blue, and you can see that absences from years 7 to 11 are almost double in every case post-pandemic. And again, it's impossible to directly attribute COVID as the sole cause of this discrepancy, but certainly the pandemic has played a huge role in this. Okay, so I'll summarize and suggest prevalence is now falling, which is good news. Hospitalizations are coming down, but as we'll probably see again when the next hospital key performance indicators are released next week, hospitals are still under extreme pressure, so the hospitalizations need to keep coming down and stay down for as long as possible to give our hospitals a chance to recover. Deaths are now also starting to fall, but the impact on schools hasn't gone away, and that's what we'll hear about now. So I'll pass back to you, Goody. Thanks.
Thank you for your presentation, Kit. And as you point out, the COVID situation in schools is incredibly worrying. And that's why it's important for us to discuss what mitigations are available and what actions are effective. And that's exactly what we're going to focus on in our main discussion today. So to kick off today's session, I now invite Professor Susan Mickey, who's hosting, along with Dr. Stephen Griffin. Over to you, Susan.
Thanks, Goody, and thanks, Kim, for those really disturbing data about the situation we're in terms of schools. Last year, Independent Sage had a raft of requests of the government of things that could be done to solve the problems that were evident last year also. And summer is the time when the government can actually affect changes. And last week's session, we heard about the importance of air quality in terms of absences, in terms of people's mental and physical health. And this is as true of schools as it is for all other workplaces and all other places of learning. And so we're really delighted to actually, first of all, to have been sent a copy of the letter signed by all of the seven trade unions that are representing all the different kinds of school staff that there are. The letter they sent to the Health Secretary, and I'm delighted that two of those signatories are on with us today, along with Michelle Wong, who's an architect specialist. So Kim Sunley, it would be great if we could start with you. I think you've got a slide just going through what the main demands are of the letter that you sent to James Cleverly.
Thanks, Susan, and thanks, Kit, for putting up the slide. So yeah, just introduce myself, Kim Sumley, National Officer for Health and Safety at Unison. I'd like to start really by paying tribute to our members who have worked tirelessly through the pandemic, teaching assistants, catering staff, admin support, finance, estates, colleagues who've, I say, worked tirelessly through the pandemic, keeping schools open, putting their own health and the risk and the health of their family at risk as well. And also just to mention, all the trade union health and safety reps in schools that have been working hard to try and get some improvements. So yeah, Susan said we sent this letter out on the 21st of July to Secretary of State for Education, and signed up by all the unions that in education. And we have 8 demands in that, which I'm just going to go through very briefly. So the first one really is one of the areas that we really want to focus on is improved ventilation. As Kit alluded to, there have been some steps taken, but we don't feel this is enough. And we feel that using the summer break to implement a programme of maintenance, looking at natural ventilation, so ensuring that things like windows aren't sealed up, painted over and can be opened, air bricks and vents aren't blocked and are clear. And then looking at, potentially improving mechanical ventilation servicing, mechanical ventilation units. And we were particularly taken by a study of Italian schools that showed that having effective mechanical ventilation systems can reduce transmission of COVID in schools by more than 80%. So again, it's really important that we focus in. I'm sure Michelle will talk about that a bit more. And again, the recent heatwave has shown the importance of having effective ventilation in schools. The second area is to provide HEPA air filtration devices at schools for September as an immediate measure. Yes, there's been some air cleaning devices put out, but not enough. I think we estimated it was about 3% of schools that have had devices put in place. So absolutely, we feel that this is a sort of tried and tested measure throughout other countries. We need to be looking at that now. And then just reinforcing other measures around making lateral flow tests available to break that chain of transmission as soon as possible. Clear public health guidance on what public should be doing around minimising the chance of infection. I mean, that's really been lacking over the last months, and guidance for workplaces and organisations and schools. Public health messaging campaign on vaccinations, giving the very low rates of childhood vaccination. And I think that's currently around 9%. So, and is a lot lower than other European countries and other countries across the globe. And updated guidance for schools on face coverings, taking a risk-based approach. So where we're seeing increased cases, the risk assessment on implementation of face coverings. We want reinstated COVID risk assessments, including vulnerable immunosuppressed workers and pregnant workers. And in fact, there is already a legal duty on employers to carry out an individual risk assessment once they've been told that a worker is pregnant. And then finally, to re-establish funding for schools to cover supply costs for teaching and support staff absences. And this has obviously been a major additional expense for schools over the last 2 years, which they'll be even less able to afford as the next academic year and school budgets are tightened. So those are our, we think, fairly modest demands, and yeah, happy to follow those up.
Kim, thanks very much for that. I was going to ask you why you felt the need to write this letter, but I think we're already quite clear, what the need is. But has anything happened? What impact has been had, first of all?
In response to the letter, to date we've had no response from the Department for Education, which probably was very disappointing. But I think the government have got other things on their mind at the moment. So no response from the government. We've had support from Labour MPs and good support online from the scientific community like yourselves, community groups, parent groups, and clinically groups representing the clinically vulnerable. So absolutely feeling that this is the right thing to do, to have this letter and not to just lie back and not do anything. And now, I think for us now, what we want to do is sort of galvanise that support into action and really encourage any parents, anybody who has a concern about what's not going on in schools to write to their MP and urge them to support these demands.
That's really helpful, and we will put the letter up on our website so that people can have access to it when they hopefully do write to their MPs on this. Kim, thank you very much, and I'm glad you can stay to hopefully answer some of the public questions later. But if I can now hand over to Steve to have a conversation with Michelle.
Sure. Thanks very much, Susan, and thanks very much, Kim, as well, for real insight into that letter. So it's a real privilege to introduce Michelle Wong, who, if people haven't seen her Twitter feed, is absolutely a world expert on building ventilation and architectural design, which feeds into that sort of thing. And it's a real pleasure to have Michelle here because her expertise is absolutely vital to putting these things into place, I think. So Michelle, thank you for coming. Could I just start off by asking a pretty direct question, which people might be a little bit unaware of, is that some people refer to buildings as sick buildings. Now, could you explain what this means?
Thanks, by the way, for inviting me. So as an architectural designer, I've worked on a lot of projects like residential and apartment blocks and office blocks, theatre design to construction. And it's very complex and it needs to integrate ventilation in that. When we think about indoor air quality, some of the things that you may not realize is that the indoor air can be 5 times more contaminated than the outdoors. And that can actually produce a range of health conditions. And that phenomena is known as sick building syndrome. And so I'm just going to give some examples. So for instance, you might find you get tired and lethargic. You might be getting a headache at the end of the day. That relates to a buildup of CO2, stale air in your room, not being replenished by that outdoor air. And then you think, well, what are all the other contaminants in the space that influences the air? And, it could be the paint in the walls, the insulation, the formaldehyde off the chairs, and then it's the shared breath of the cough and the colds with everyone in the space. They produce a variety of triggers for health problems. And then you think, but how good is that air outdoors? If the air outdoors is dusty and highly pollinated and polluted, it's going to make my vacuum filter black. What does that do to our health? So sick building syndrome, sorts of things like asthma, increased skin allergies, cardiovascular disease, air pollution, we know annually actually causes 34,000 annual deaths prematurely. So, this COVID-19 has put indoor air quality on the map. It has always been a problem, and we need to put clean air as a key part of public health. And that means refurbishing the design of the buildings to last, good ventilation and filtration as a minimum, at least 6 air changes per hour.
Well, I mean, that's quite a frightening concept, isn't it? The sort of, our everyday places of work, schools, everywhere else that can actually physically make us unwell. And it's important to emphasize as well that this is not just about SARS coronavirus 2. It's about other conditions. It's about other viruses and other bacterial infections that could make people unwell as well. And, places like hospitals, this is going to be incredibly important, and especially as many of our hospitals aren't exactly the newest buildings in the world, are they? So, just moving on then, focusing now specifically on schools. Why do you think it's so important to deal with this problem in schools with some urgency, as we've been talking about?
So as I've been involved in indoor air quality research, I hadn't realised we actually spend 90% of our time indoors. And the bulk of that time for children and young people is in schools. So that inhaling the quality of that air, we've got to worry. Children are vulnerable and they're developing, their lungs and their brain at this phase. They know contaminated air can stunt lung growth and impact on cognitive ability. So the Lancet did a report last year, a COVID-19 Safe Schools Task Force did a report showing that good ventilation and air cleaning can increase child pupils' focus and test scores and decrease the rate of illness and absence and things like asthma. So where children learn is as important as what they learn. That is quality learning. The government must invest in safe learning for healthy learning environments.
No, I think that's really important. And, you hear quite a lot of stuff on social media about how some people believe that kids should be getting ill all the time to try and boost their immune system, some sort of warped hygiene hypothesis theories, which really don't help in these sorts of scenarios, do they? So that's great. So, we've talked about this briefly with Kim, but what do you think could feasibly and should be done this summer? I mean, never mind summer 2020 or 2021, but this summer, if we were to try and prevent what is very likely to be potentially a combined wave of SARS coronavirus 2 and influenza and RSV and everything else as we hit the winter, what do you think the government should be and could feasibly do if we just had these 6 weeks left?
Yep. So we have these 6 weeks left. And just to say, the DfE knows that the schools have been left neglected since 2017. There's 11.3 billion worth of building repairs. That's just Band-Aid measures, never mind the need to upgrade the mechanical ventilation and the insulation. And so in the short term, without needing to refurbish buildings, the quickest way is to deploy portable air cleaning devices in every classroom, because we know the learning disruption from last year. It will be difficult to open windows in winter when it is raining and cold, when 1 in 4 schools are in air polluted environments. So because I'm in touch with a number of other experts about air cleaning devices, I've worked out quickly the cost health benefit. So, you could spend £30 for your child on a supply teacher to teach the kids when the teacher's sick, or you could spend, half of that, £10 to £15 on a clean air filter unit for the classroom that will give clean air for the entire year, keep the teachers happy, make the pupils, enjoy their learning because it's a healthy environment and they're attending. So it's a no-brainer. It's a win-win to invest now in this time to deliver portable HEPA cleaning units or air cleaning devices, shall I say. Yes.
Yeah.
And just to say, many other Western countries have already made a head start. USA, Canada, Germany, and New Zealand are now preparing for winter. We are lagging. So in this summer break, if the government doesn't take action, we will have to take action ourselves. I think there is a way to do it in the community amongst the teachers and the parents to do that.
No, absolutely. And, important to say that if we do have these filters in, then these CO2 monitors, which are already probably set at the wrong red level, aren't really going to make much difference because the CO2 doesn't go down with a HEPA filter, in case people are just wondering about that. Thank you so much, Michelle. We'll almost certainly come back to you with the public questions, but I'll now hand back over to Susan, who's going to introduce our next guest.
Thank you, Steve. And a very good moment to switch over to Mary Boustad, who is Joint General Secretary of the National Education Union. And Mary, I wanted to start off by asking you, what are the main issues from your perspective?
Well, I think the main issues from the perspective of the National Education Union is that education continues to be significantly impacted and disrupted by COVID. I mean, staff absence has been an issue throughout this year. On the 7th of July, the DfE estimated that 42,000 teachers and leaders were absent from school. Now, the figure fell by the 21st of July to 27,000 teacher and leader absences and 34,000 support staff absences. Now, we don't know the reasons for this absence because, as as Kit said, the reasons for them have not, they're now not collecting reasons for absence under COVID. But it seems, absolutely without doubt that many of these absences will be COVID related. And our position, the National Education Union position, has always been, and it always seemed logical to us, that in order to bear down on staff and pupil absence, and I'll talk about pupil absence in a minute, you have to try and stop them catching COVID and stop them spreading COVID. And, our concern is that the government's position just seems to be let the virus rip through schools time and time again in waves and ignore anything that might really reduce the long-term impact. So the measures that Michelle has been talking about. Now, it's not just staff absence, it's also pupils. So Kit was talking about the Sutton Trust research, and it's showing how the absences for pupils have also greatly increased on pre-pandemic years. And again, we don't know now the reason why, absolutely, because the government isn't collecting that information. We think they should be, but it seems impossible to us that much of this is not also COVID related. And the other aspect of the Sutton Trust data that Kit referred to was that, so this study was done with year 13 students taking their A-levels. So, and we know that COVID-related absence has impacted on them more than on pupils in earlier years, maybe because they get iller, I don't know, but that it's been impacted upon them. And so, as Kit said, a third of A-level students who apply to university have missed 11 or more days for COVID-related reasons, and 1 in 5 over 20 days, a month of teaching and learning. And the concerns for us are about the increase in unfairness this brings to those students, because we know from previous waves when the government were collecting the figures that it's pupils in the most deprived areas of the country who are more likely to be living in overcrowded multi-generational houses who are suffering the greatest amount of COVID-related absence. And so teachers continue to be really really concerned about the impact of COVID on education. 72% of teachers consulted by the Sutton Trust feel that the attainment gap in their school will widen with the return of exams, and 29% of those teachers working in schools for deprived pupils, because our school population is heavily stratified in terms of social class, 29% said that this increase would be substantial. And working class students, and remember, if you're a working class student who's managed to get to do A-levels at 18, you have already overcome significant odds. It's you are already more determined, more committed, more with greater resilience against the odds to get to that position, because fewer working class students take A-levels compared with middle class students, and 62% of working class students at 18 felt that they'd fallen behind in their studies compared to where they would have been without the pandemic. And that feeling was much worse with working class students than with middle class students. They were more likely to be more worried about the gap in their education, and more likely to be worried that they were going to not achieve the standards of which they were capable. So there are real implications both for teachers and support staff and for students and pupils.
I think the issue you raised about inequalities is huge, isn't it? I mean, it's something that we have raised over the whole of the last 2 years in general, in all the different sectors of society, but especially and in several of our reports in relation to education and schools. So it's not only the disruption and the effects on their education in terms of the prevalence of COVID at schools, but also when they are having to be at home. It's the lack of digital support for them. It's the lack of quiet spaces for them to be able to study. It's the lack of people around them who can help catch up. So they're really disadvantaged in so many ways. And, you know, I have to say, I think the efforts of the government to try and compensate, at least it's been recognised, which is a start. But I think the efforts to try and compensate are not nearly enough compared to what's needed. So I think this will be an ongoing conversation. But before I hand back to Goody and the public, I did want to ask you another question, Mary, which is, how can staff work best with parents and the broader community in their efforts to make schools safe places for staff and children?
Well, the NEU, the National Education Union, and the other unions, Unison, the GMB, Unite, their heads unions, they've all tried to. One of the reasons we work so hard to work together to get COVID safety checklists in schools, and work so hard to communicate to staff and through staff to the community. And in fact, the National Education Union did an international, we worked really hard at the beginning of the outbreak to do some international research to look at how other countries in the Pacific Rim, Asian Pacific Rim and elsewhere, were coping with the COVID pandemic, and what lessons we could learn from the SARS pandemic in the Asian Pacific Rim. And we then wrote together the COVID checklists and the guidance. And we also we had on our website guidance for parents about how to support home learning, what parents could do to support their children in learning, what parents could do to support their children in staying healthy. We supported the vaccination program for young people when it came out. I mean, I am the proud recipient of a letter sent to me by Piers Corbyn and others, signed in green ink, threatening the NEU and myself with genocide, with war crimes and genocide, because we supported the vaccination of older teenagers. Now, we did that because we want children to be in school and young people to be in school and learning. And we were always very clear. We always were very clear that COVID was unlikely to cause severe illness for the vast majority of young people. Disproportionately and hugely, it's an illness which affects older people. That's the key, as I understand it, one of the key danger sign for COVID is the contingent upon age and other vulnerabilities as well. But so we never tried to frighten parents or young people. We never did that. We said, if you get COVID, you're either like to be mildly ill or not feel it at all. The issue is that despite the government's denials, Boris Johnson was forced on the 4th of January 2021 to say that schools may act as vectors of COVID transmission. And you looked throughout the course of when the pandemic was at its height, you looked at the drop in infection rates when schools were off, and then the rise when they were back. And it's clear, having 1,000 unvaccinated young people and children in the schools with largely unventilated buildings and very, very crowded, why would they not be vectors to COVID transmission? So we've done everything we can not to frighten, but to inform and to educate. And that has been the work of the National Education Union and the other unions as well. And I think, if you listen to Tory politicians, you would think that we were responsible for schools closing. No, it's governments that close schools, and they close schools because they didn't act quickly enough. They locked down too little and too late. Boris Johnson, famous libertarian, repeatedly delayed locking down. And also the other issue is, of course, that the government's own education recovery czar, Sir Kevin Collins, said that £15 billion would be needed for education recovery, which Boris Johnson said was his top priority coming out of the pandemic. Less than a third of that has actually been provided. And so the things that Michelle said are needed in terms of clean air, but also a long-term provision of remote education, ensuring that there is a digital connection throughout the country. And then even wider socially, not having 4 children sleeping in one bed because their parents are in a 2-bedroom flat, which, you know, as when I'm canvassing during elections and local elections recently, you know, that's the situation I found repeatedly happening in flats in my local ward, throughout my local ward. This issue of overcrowding in inadequate housing is massive. So there are much bigger societal issues as well as educational issues.
Yeah, absolutely. Mary, thanks. Great points. And also Michelle and Kim, great points also. So that's a fantastic introduction to this conversation. And now we'll hear what the public are asking. So Goody, back to you.
Thank you for that. And yes, what a scintillating discussion. And actually, yes, as you said, introduces us really nicely to our discussion, because as Mary just really nicely summarized, this is a complex issue. It's not just about infectious disease. This is about society and how we run it and how we look after each other. And we talked last week about the architectural dimensions of this. And actually, some of our public questions are from last week's session, but they link really nicely to what we're talking about this week in terms of schools. So I'm going to start actually with Maya, who's joining us this week. Maya, are you there?
Hi, I'm here.
Hiya, Maya. What's your question?
So I'm going to expand a tiny bit more than what I emailed in, with having listened to everything, if that's okay. It's obviously very hard to implement safety in institutions such as schools. Nowhere near enough HEPA filters, as we've heard, windows aren't open enough. So this is kind of about our personal safety, and linking back to safety for children in schools. And as someone who's battled long COVID since the start of the pandemic, I try and minimize my risks as much as I can with all the sacrifices that brings. So for situations I absolutely have to be in a situation, same for pupils in schools that have to be in schools, I research how can I protect myself the best as I can. So I've come across ionizers, personally wearable ionizers. I'm quite baffled that I've not heard about them before, because I'm always looking for, you know, latest technologies and everything. So this one I've got here, it emits 50 million ions. It runs for 28 hours. It's rechargeable. It's under £100. It's not an advert. I'm just saying what I bought myself. So it's something you can implement individually quite easily, where you don't have the protection of everyone coming together wanting to, you know, keep the virus at bay. And also what I really loved hearing Michelle talk about is it's not just viruses, it's the VOCs, it's the mold, it's the dust, etc. So this apparently is what it does. So I'd really love to hear expert opinion on an explanation, how exactly does it work, and should we invest in those as individuals? And yeah, is that something we should all have and have air around our neck, or did I just invest into something that I shouldn't have?
Thanks, Maya. That's a really interesting question. And I can see that Michelle has her hand up and probably is the person to go to in terms of expertise on this topic.
So the science evidence base for cleaning air is mechanical measures with filtration or germicidal ultraviolet light. Many aerosol scientists have commented about chemical reactions in the air, and ionizers produce things like ozone, which is harmful to breathe for your lungs. So I'm afraid that is mis-selling technology. The best way to keep yourself safe is a layered approach. Wear an FFP2 or FFP respirator to protect yourself and others, because you might be asymptomatic and you don't want to infect other people. And you can protect yourself with 99% filtration of the mask from a virus acute. So it helps if we collectively wear masks.
Mhm.
And then on that layer, it's the isolation, if you are positive, so that you aren't in a space to transmit the virus. And then on top of that is ensuring good ventilation, getting the CO2 level below 800 is the aim. And if you can't do that, you've got to add filtration or specialist advice on UV installation. Ionization is not a solution. That is producing harmful chemicals in the air.
Okay, may I ask something here still? Yeah.
I think we'll move on to our next question, Maya, but thank you so much for
Okay.
introducing that topic. And I think you'll find that our other questions will kind of pick up on those issues. Our next question is actually from Nick, who's also joining us. Nick, are you there?
Yeah, hi, can you hear me?
Yes, Nick, go ahead with your question.
Thanks. I just wondered, like, a year ago, I couldn't understand why all schools weren't just sent HEPA filters. But I just wonder, with time moving on and the resistance that there seems to be to doing anything at all, whether or not it would make more sense to be putting all the push behind trying to go straight to GUV, which my understanding would be maybe perceived as being less intrusive, less temporary. I think Michelle's probably answered it in her piece by explaining all the other benefits that the mechanical filtration gives. But anyway, that was the question: is wouldn't it be nice if all indoor spaces had GUV and then it would be safe to go out again?
Interesting question, Michelle. I'm again coming back to you because I believe that you're probably the expert on this. What do you think?
Oh, sorry, I couldn't actually hear very well. Could you repeat the question?
So Nick was essentially wondering whether we should be pushing for permanent UV installations instead of HEPA, given that HEPA could be conceived as temporary, noisy, and intrusive. And basically, do you think that would be a good alternative?
So it is an alternative. There is a hierarchy of risks. So the lowest level of risk is putting in technology that is readily available, that is filtration measures. And yes, with UV, that requires specialist help with installation, whereas with the portable air cleaning device, you could get support with calculating the required air changes per hour and support with help with selecting an appropriate device that can be plugged into any classroom, whereas germicidal UV and far UV requires, and I think that is also more research on the far UV, but the germicidal UV needs specialist support in installation. It's not always appropriate in a classroom because the ceilings are also low. There's I think the limit of where UV can be put in is about 2.1 meters ceiling height. The average school ceiling height is about 2.4 in a low one. But, you know, there's potential there. It needs specialist support. Whereas putting in a portable HEPA cleaning unit or air cleaning device like a Corsi Rosenthal box is far quicker to do.
Thank you, Michelle. And as always, your answers are always so clear and so coherent in terms of how you go about explaining it. I'm sure the public are finding this really, really helpful. I'm going to move us on now to our next question, who is from Odilon, who's also joining us. Odilon, can you hear me? And are you able to ask your question?
Yes, I can.
Hiya.
I am able. I'll try to be quick, but it's slightly longer than it should be. My child's school has actually taken the issue very seriously, and I've worked with them for the past 2 years. We bought HEPA filters, we surveyed all the classrooms for CO2, we changed all sorts of window arrangements and doors for mitigation. They took it seriously, but it strikes me that it's almost impossible because there are so many pressures. They're so overworked and so understaffed. And right now they're under huge pressure to sort of pretend everything is back to normal. So we have maybe a quarter of the HEPA filters we should have. There are still plenty of people going out sick. And my question, the big question is, what would help? What is necessary to convince schools to introduce or to make them really feel the pressure to introduce serious mitigations like HEPA filters in every classroom, or ventilation that's measured and confirmed, because just opening a window, unfortunately, often isn't enough. Even a door and a window isn't enough. We've measured it. And if there's no wind outside, it just doesn't work. You still have CO2 at 2000. But we have a little bit of data, and I'm wondering, is there any initiative from people on this call or elsewhere to collect systematic data of what has worked, which schools have done this well in the UK, so we can present it and convince people that A, it's possible, but B, it's necessary and it has real health benefits. The tiny question that I thought of during the union rep presentations is, if there is not a serious response to your 8 demands, will you call for industrial action? Because that would produce the kind of pressure that might lead to real change. Thank you.
Odilon, thank you so much for your question, which you almost answered yourself, I think,
I don't know the answer.
Partly. I'm going to open this up to everybody, because it's again, it's very complex. It's not about specific technicalities here. It's about organizing and how we put pressure on those in power. So I can see that Christina has her hand up, and I think Anthony had his hand up afterwards. So Professor Christina Pargol, do you want to go first?
Sure. So actually, I think this is a really important point, is that we know that, clean air is a good thing, and we kind of know how to do it. And there are, like we do have CO2 monitors now, there are some HEPA filters in schools, but there is this big gap because schools are so overwhelmed already that actually putting that into practice can seem impossible. And putting pressure on the school isn't the way around that. So one of the things actually that I'm trying to do now is to get funding, and I'm working with a few London councils to actually look at what are the barriers, and are there ways that we can potentially, for instance, have facilitators in boroughs that will take on the burden of installing it and running it and keeping it working, that takes it off teachers, takes it off heads, and actually implements what we know is the right thing to do, what the Royal Academy of Engineering has said is the right thing to do, to use all the research that people like Kath Noakes have done. So how can we bridge that gap between knowledge and practice? So that's what I'm trying to do. It's not going to, be a magic bullet, but I think just adding pressure and blaming schools just is never going to work, and that's not going to change anything. And we know that this kind of thing is really difficult to do.
Thank you, Christina. Professor Anthony Costello, I think you had your hand up next.
Yeah, sorry. I mean, we've heard today from Kit about doubling of absences compared to before the pandemic, 25% of secondary school, primary 3 to 5% long COVID. I mean, these are staggering figures. And in the United States, 40% of children aged 5 to 11 are being vaccinated, and they're worried about it. This is latest CDC figures. And in the EU, Western Europe, anyway, it's around 25%. In this country, I just looked the figures up, 700,000 out of 9 million primary school children have been vaccinated, which I make about 8%. So 92% of primary school children have not had a vaccine that was approved 14 months ago by the MHRA. Why is that? It's because of mismessaging from the government, a lot of senior pediatric advisors putting out false information about risks, where the risks of the infection are far, far greater than any small risks from the vaccine. And I think it's a disgrace. And being 5 times lower than the United States, which is not exactly known for its great public health, is an utter disgrace. And it's the condemnation of a government where the last health secretary, or maybe the one before, basically said, oh, it's Freedom Day, it's over, it's all finished, pandemic's over. It's a disgrace what's going on. I'm just getting that in because biomedically, immunization is as important as any of the other things. But let Michelle talk about HEPA filters, because that's equally important. Well, nearly.
Thank you, Anthony. Before we come to HEPA filters, I do want to talk about government responses, though, Anthony, because that's an important thing. And Odilon did ask about what the unions might do on this. And Kim, I wonder whether it's a good opportunity to bring you in and to bring that perspective on this question.
Yeah, thank you, Goody. It's been incredibly frustrating every step of the way. We have, lobbied, we've written to government, we've written to the Health and Safety Executive, and it is it's been an incredibly frustrating journey. At the moment, I think because we're a member-led organisation, we don't get a response. We'll have to go back to our schools committee, our members, to see what the next steps are. So as much as, you know, I can't make that decision here and now, but I know there's a lot of anger, frustration, a lot of burnout, and people have just had enough. So, you know, I think at the moment we put our efforts into trying to get a response to this letter by, you know, getting supportive MPs behind it. And then, you know, we will take this back to our, you know, our membership, our schools committee to decide what the next steps are.
Yeah, massively frustrating and an ongoing issue. Michelle, I presume you're going to come back on HEPA filters, although you did mention a community plan. So I wonder if that's what you're going to be talking about.
Yes. I think one of the things that is happening out on the ground in the community is there's not an understanding of the importance of clean air, and that this is actually a building professions related issue, a buildings issue in every place. It's not just schools. We need to stop washing hands, because I've been in touch with a parent whose child is the only child wearing a mask, a respirator in the school. And he is actually they've had a meeting with the head teacher and the SENCO, and they've admitted, well, you know, we have to move on. And they're allowing the child to wear the mask. The mum is gobsmacked because the SENCO says, I have a lung condition now from COVID, but that's why I wash my hands. And so there is a problem in the community not understanding the importance of the delivery of clean air, of opening windows. You will see it on a normal, not even a very hot day or not in a very cold day. No one is opening the windows. We need to remind everybody, actually, it's really good to do what the Germans do, open the windows regularly. And, you know, if you're not getting enough air, and if the air is polluted, you can fix that by putting an air cleaning device. We don't have that messaging around the importance of air. We've got a message about, let's just let the vaccines do its job. We need a vaccines plus strategy in order to deal with disease resilience in the future. We need a buildings upgrade to deal with climate change. So this is a big thing for the future.
Thanks, Michelle. Mary, you've got your hand up.
Yes. Just in that question about industrial action, I think it's important to note that on the 3rd of January, the NEU held a Zoom call for its members, because you remember this was 2021 and it was just at the beginning, well, the Delta variant was ripping through schools, and the then Secretary of State for Education, Gavin Williamson, said on the 4th of January, all primary schools had to go back. And in addition, there was a big thing about some schools in London, some boroughs going back on the 4th and others a 2-week delay, and the department couldn't explain why they'd chosen some boroughs rather than another, apart from the fact that all those boroughs were Labour boroughs, whereas all the Conservative boroughs got a 2-week delay. And we held a Zoom call for our members. We had a 30,000 limit on the Zoom call. We knew that wouldn't be enough. So we were able to do something whizzy and get it broadcast on YouTube. Had 400,000 people live on that call. And we advised our members that they had a right under the 1996, Section 44 of the 1996 Health and Safety at Work Act, not to go into a workplace that was dangerous. Remember, this was before vaccination as well. And by the end of that day, a quarter of primary teachers had signed Section 44 letters and informed their head that they would not be going into a dangerous environment in work the next day. And the next day, Boris Johnson went on the airwaves and said that unfortunately schools were acting as vectors of COVID transmission. I think I've got the year wrong there. It was before vaccination, so it wasn't 2021, it's 2020. 4th of January 2020. COVID is just one log. Talk about long COVID. For me, COVID, I remember COVID now as one long 2.5 year massive stress. My neck still hasn't recovered. I still have to take pain relief for my neck because of the stress that I experienced with members contacting us in huge fear. The idea that we can get members to do industrial action and to stay away from schools again, they will not do it. They hated long distance learning. They are acutely aware that it is the poorest and most vulnerable children who didn't learn. They're acutely aware of the attainment gap. What my members want, what our members want, are safe schools. They do not want the return to distance learning, and they do not want to take industrial action over COVID. They will do probably overpay and workload, but COVID speaks to something bigger in the educational psyche about educating children, and children education is a social act, it's a communal act, and the schools are really important institutions, particularly for the most vulnerable children. Middle-class children suffered isolation, but they're likely to suffer isolation in a household where they've got their own bedroom and enough to eat. When schools close, those basic guarantees of enough to eat, being fed, being warm enough, those are not guarantees in a very, very unequal society for the most disadvantaged of children. So I don't see any, just to be honest, teachers will not take industrial action over COVID.
Thanks, Mary. That's really interesting to think about the professional obligation there to try and make sure we serve out the children of this country. Before we move on off of this question, I'm just going to ask Professor Stephen Reicher to feed into this. I think he's had his hand up for a little while.
In January 2020, so just as the pandemic was starting, the Royal College of Paediatrics and Child Health put out a report on clean air in schools. And it made a completely compelling case, because when you look at the data, and it's already been referred to some extent, that clean air has a whole series of effects. It improves cognition and decision making. It improves test results. It improves productivity. It reduces absenteeism. And that's before you factor in the impact on physical health and on mental health. And it's before you factor in the impact of COVID. So I think the point that we've got to make is this is not just about COVID, that the issue of clean air is every bit as important in the 21st century as the issue of clean water was in the 20th and 19th centuries. It's got to be an ongoing campaign. And even if people want to pretend that COVID is all over, that doesn't take away from the need for this campaign. So I think it is absolutely essential to make the point of just how compelling this is. And when people say it's too expensive, the report of the Royal Academy of Engineering showed that if you factor in the impact of clean air on productivity, then in commercial spaces, you gain £6.50 per square metre for putting ventilation in. And when you look at community spaces, you gain £13.60 per square metre. So the economics are on the side of ventilation. So as I say, I think we need to put this in the context of a wider public health campaign on clean air, which is during the pandemic, but which endures. And in terms of what we do about it, well, by now, none of us are surprised at the absenteeism of this government. I mean, you know, we're in the middle of a huge crisis and the Prime Minister is on holiday from his holiday and the Chancellor of the Exchequer is on holiday. We're not going to get anything out of them. But I think there are two initiatives that we can undertake. The first is that one of the things that has disappointed me is the lack of opposition. The Tories have got away with it because there hasn't been an opposition. So I think everybody who's listening, who's a member of the Labour Party or the Lib Dems or the Greens, ought to be asking, where's your plan? Where's your alternative? Not just around COVID, but for clean air. And I think we can build a campaign, a coalition with trade unions and parents and opposition parties, which is a determined campaign around clean air. And secondly, and as one aspect of that, people have heard of the COVID pledge, which is a pledge to look after the health and the safety of people, of workers, and of children and of customers and so on. And the NEU, and thank you to Mary, the NEU has signed up to the pledge. So again, parents can go to schools and ask headmasters to sign up to the pledge. And if not, what are they saying? Are they saying they're going to encourage infected teachers and children to come to school? So I think there are a couple of very concrete campaigns that we can support. But as I say, the key thing is, I don't think we have much faith in this government, but we need an opposition and we need an alternative. And I think we can build that alternative.
Well, Stephen, that was a really rousing way to kind of summarize all of the issues that we've covered in today's session, which is ultimately that this is so much bigger than just COVID. It is about the environmental determinants of health as much as it is about the infectious determinants, but also about how there's been a long-standing neglect, quite frankly, I can say this as a paediatrician, of children and young people in this country in terms of their health and their well-being, and also of the people who take care of them and educate them. And that's ultimately what we're seeing in all of this and in the effects of all of this right now. I'm afraid that we have run over a little bit, and this is all we have time for today. We've had fantastic questions that have generated a really vibrant discussion and really useful insights from all of our guests. As usual, a big thanks to all of our scientists who join us week after week. Thank you to all of our guests for their fascinating input, and also to the members of the public who continue to support us. We will be back next week at the same time, same place. In the meantime, do stay safe. Goodbye.
Bye. Thanks all.